It has a high concentration of regenerative cells. In fact, from 1 gram of adipose tissue, 5,000 stem cells can be isolated, which is 500 times more than from an equivalent amount of bone marrow. And it has also less risk associated with autologous therapies. Adipose tissue consists in adipose niche. The niche is the native microenvironment that contains adipocytes and other cells, embedded in a collagen scaffold with a vascular network. Here I reported the components of the niche. We can find adipocytes, extracellular matrix with collagen mainly, pericytes, pre-adipocytes, microvascular cells, and other cells. But focus on the pericytes. These are cells that are wrapped around capillaries and microvessels within adipocyte cluster and facilitate communication with cellular microenvironment, reacting to signals from injury. Here, in fact, there is the proposed sequence of cellular changes after injury. From an injury, the pericyte become a mesenchymal stem cell, then activated, and the cell with a regenerative potential. In fact, the pericytes have trophic effects, secreting lots of bioactive molecules. It has also mitotic, angiogenic, anti-apoptotic, and antimicrobial effects. The use of adipose mesenchymal stem cells, either expanded or obtained by enzymatic digestion, has recently created a great interest, and several studies demonstrated their regenerative and immunomodulatory properties, both in vitro and in vivo. Several are the surgical fields in which it is used, such as plastic surgery, urogynecological surgery, orthopedic, oral and maxillofacial, general and vascular surgery. But not only, also in colorectal surgery. Here I reported some paper about the use of these kind of cells in fistula in ano, but mainly in Crohn's disease, but also cryptoglandular fistula. And but the enzymatic treatment or cell expansion have a large number of processing steps, significant costs, and the restriction related to the GMP regulation. That means complex regulatory constraints. Hence, minimally manipulated autologous adipose tissue as a therapeutic option would be preferable. Tissue is considered to be more than minimally manipulated if the process alters the original relevant characteristics of the tissue relating to its utility for reconstruction, repair, or replacement. And adipose tissue consists, we already said, in connective tissue composed with cluster of adipocytes and other cells, so the adipose niche. We know that enzymatic digestion to isolate the stromal vascular fraction is considered more than minimally manipulated. So LIPOGEMS systems instead use only saline solution to wash, rinse, and resize the adipose tissue, and to remove blood, oil, and cellular debris. So we can conclude that the LIPOGEMS is minimally manipulated according to the regulations set forth by the FDA. This is a device approved by the FDA in the US in December 2014 and is qualified as HTTP. That means human cell, tissue, cellular, and tissue-based product. We said the difference between enzymatic digestion, that needs a lab preparation and days, instead of gentle mechanical manipulation that means one-step procedure. Moreover, LIPOGEMS samples show the maintained vascular stroma, in which the vascular channels have evident lumina. On the contrary, the conventionally treated fat tissue show compressed and distorted microchannels. And then, also in the LIPOGEMS sample, the expression of CD146 is higher, and this is a marker of endothelial cells and pericytes. So we can conclude that LIPOGEMS maintain the vascular stromal niche. It's an enzyme-free procedure and one-step procedure.